Assalamualaikum warahmatullahi wabarakatuh.
My name is Nurma Harunisa.
My name is Yasmina Zahra.
Hello guys, my name is Diska Maulin Nurmala.
Hello everyone, my name is Nabia Jatikawati.
Hi guys, my name is Dini Martini.
We are from group
7.
Public health is the cornerstone of a thriving society. It encompasses three vital functions. That work together. To safeguard communities and promote well-being. Assessment is the foundation. Imagine a team meticulously gathering information on health trends, disease, and community needs, digging deep to understand the pulse of a population, from tracking infectious disease to analyzing environmental factors affecting health. This function empowers decision makers with valuable insight. Policy development step in. Translating this world information into actionable plans. These policies influence everything, from healthcare access to environmental regulation. Assurance complete the triad. It ensures that its plans translate into reality. Ensuring equitable access to quality healthcare services for all. Especially the most vulnerable. It is about making certain that communities receive the necessary services regardless of their socio-economic status, race, or geographic location. assessment of policy development and age range. This core function of public health from a robust framework uniting communities towards a healthier, brighter future for all.
10 essential public health services.
Firstly, carry out health monitoring. Public health services involve continuous monitoring of public health to identify health signs and problems that may require intervention. This involves data collection, analysis, and reporting of results to the appropriate authorities. Secondly, diagnose and investigate diseases or public health conditions. Public health services also involve the process of diagnosing and investigating diseases or public health conditions that may affect the population at large. It involves the causes, spread, and impact of the health condition. Thirdly, inform, educate, and empower. Public health services aim to inform, educate, and empower people to take actions that support their own health and that of the population as a whole. This could involve outreach campaigns, prevention programs, and counseling services. Fourthly, mobilize community partnerships. Public health services also involve mobilizing partnerships with communities, non-profit organizations, government, and the private sector to work together in efforts to improve public health. This includes collaboration on prevention programs, policy advocacy, and social support. Fifthly, develop policies. Public health services are also involved in developing health policies that can affect the population at large. It involves research, data analysis, advocacy, and collaboration with stakeholders to create policies that support efforts to prevent and improve public health.
Sixthly, enforcing laws such as regulation related to drug abuse and protection from exposure to dangerous substances. For example, the Food and Drug Supervision Agency or BPOM is responsible for drug and food supervision, inspections of medicines and food circulations on the market. Seventhly, providing care for those who need it, especially in terms of preventing infectious and non-communicable disease, immunization programs, maternal and child health service, and halting disease outbreak. For example, Dr. National Central General Hospital, Cipto Mangunkusumo, or RSCM, is a government hospital that provides complete care, including inpatients, outpatients, and emergency service. Eighthly, public health services are also responsible for ensuring a workforce that has the appropriate competence and qualification to provide quality health service to the community. Ninthly, evaluate the health programs that have been implemented to assess their effectiveness and make improvements and change if necessary so that the program can provide maximum benefit to the community. And finally, point is almost the same as before. Research to identify public health problems, find solutions, develop implementation in the field of public health to improve the health and welfare of society is a whole.
Core functions at the government level include federal, state, and local levels. At the federal level, an example of an assessment conducted is the National Tobacco Public Health Surveillance. Every year, more than 8 million people die from tobacco use. Most tobacco deaths occur in low and middle-income countries, which are often subject to intensive tobacco industry interference and marketing. Through tobacco surveillance and monitoring, World Health Organization seeks to increase the availability of surveillance data on tobacco use, exposure, and related health outcomes. In 1998, World Health Organization, the United States Center for Disease Control and Prevention, or CDC, and the Canadian Public Health Association, or CPHA, initiated the Global Tobacco Surveillance System, or GTSS. The purpose of the GTSS is to enhance the capacity of countries to design, implement, and evaluate their comprehensive national tobacco action plans, and to monitor key articles of the World Health Organization Framework Convention on Tobacco Control. Currently, the GTSS includes tobacco-specific data collection for adolescents 13 to 15 years and adults 15 years and older through the Global Youth Tobacco Survey and the Global Adult Tobacco Survey. Policy development with smoking bans on commercial flights. Rules relating to the prohibition of smoking on aircraft were pioneered in the United States through the Federal Aviation Administration, or FAA, in 1989. This is very reasonable because all objects that emit fire can be dangerous for aviation. All domestic and foreign civil or commercial flights must inform passengers that smoking on board is prohibited. Later, this rule was used by many airlines in the United States, both domestic and overseas. Because it was considered very positive, finally, the smoking ban rule was adopted by all airlines in the world, including in Indonesia. An example of a federal grant for anti-smoking research is the U.S. donor Bloomberg Initiative, which has reformed its funding program for tobacco control projects in several countries. Indonesia is included in the 10 priority countries targeted. Reporting from the official Tobacco Control Grants website, this funding program was held to support tobacco control efforts in low to middle income countries. This is in line with the recommendation of the World Health Organization and the WHO Framework on Tobacco Control, or FCTC. This funding grant program is open to any organization, whether a government agencies, non-governmental organization, universities, or other independent organizations. The Bloomberg Initiative to Reduce Tobacco Use Grants program has provided funding to a number of organizations spread across 76 countries, including Indonesia. The United States has decades of experience in implementing comprehensive tobacco control programs, particularly at the state level, funded largely through tobacco tax initiatives. These programs have resulted in reduction in tobacco consumption that far exceed the national average. The states with the longest history of such programs have served as models, particularly California and Massachusetts. The first such program in California was funded by the California Tobacco Tax and Health Promotion Act of 1988. Massachusetts, the second state to start a similar program, after a successful tobacco tax ballot initiative in 1992, launched a coordinated effort to denormalize tobacco use. The Massachusetts Tobacco Control Program features a number of key dimensions with the goals of preventing smoking among youth, increasing quitting opportunities for adult smokers, and establishing smoke-free public places.
The Indonesian government set a foliage for tobacco excise rate in 2022 to increase by an average of 12.5%. This is based on the decision of an internal cabinet meeting chaired by the President of the Republic of Indonesia on December 13, 2021. The determination of this excise tax rate requires a long process. Previously, we have discussed with the Cigarette Industry Association, the Ministry of Labor, and the Ministry of Health and others. This excise tax increase has considered aspects of health, labor sustainability, eradication of illegal cigarettes, and state revenue. In the health sector, this excise tax increase is expected to improve the true function of excise tax, namely consumption control and circulation control of dangerous goods that interfere with public health, especially cigarettes. This is also part of 2020 to 2024 National Medium-Term Development Plan to improve the quality of human research. This is also part of 2020 to 2024 National Medium-Term Development Plan to improve the quality of human research through a reduction in smoking prevalence, especially among 10 to 18-year-olds, which is targeted to be 8.7% in 2024. Okay, next students that continue for campaign to Proposition 99. Proposition 99 is an initiative that aims to regulate political campaign financing in California. The initiative includes several changes to the campaign financial system, including limits on donation from individual or corporation, as well as the establishment of a campaign guarantee fund. Campaign guarantee fund is a mechanism that aims to ensure that the candidate who receives donation from public funds must meet certain requirements before they can receive those funds. This requirement could be the amount of donation received, campaign time limit, or transparent use of funds. To implement a campaign guarantee fund through Proposition 99, some of the steps that need to be taken are: 1. Determination of the amount of guarantee fund required. 2. Establishment of a supervisory body responsible for managing the guarantee fund. 3. Establishment of requirements that candidates must fulfill before they can receive the guarantee fund. 4. Establishment of a mechanism to determine whether or not candidates meet the requirement. 5. Establishment of a mechanism to return the guarantee fund if the candidate does not meet the established requirement. By implementing a guarantee fund for campaign through Proposition 99, it is hoped that it can reduce the influence of money in politics and ensure that candidates who receive public funds actually meet the predetermined requirement. Okay, next to local report on tobacco use. Local report on tobacco use in Indonesia reveal various effects that reflect the impact of tobacco use on public health. Indonesia has the third highest number of smokers in the world, with the highest prevalence of smokers in 2011. Cigarette production in Indonesia also continued to increase, reaching 270 billion cigarettes in 2011, while the population is around 230 million. Data also show that there are 92 million passive smokers in Indonesia, with 11 million children aged 0 to 4 years exposed to cigarette smoke. Tobacco use also has a significant economic impact. Indonesia loses $37.2 million annually to treat non-communicable diseases caused by tobacco, equivalent to 7% of the gross domestic product. In an effort to counter tobacco use, WHO has facilitated a study on the impact of tobacco use on the Indonesian economy. The study suggests fiscal measures, particularly excise tax increase of less 25% per year, as the most effective way to reduce tobacco use and improve health, especially among children and adults. Tobacco control efforts in Indonesia are critical to protect public health, with report and study illustrating the negative impact of tobacco use. It is hoped that tobacco control measures can be improved to increase public awareness and reduce its adverse health and economic impact. Policy development of local law that prohibits smoking in public places. Policy development of local law prohibiting smoking in public places has been a focus of the Indonesian government. Law number 36 of 2009 on health has required local government to regulate the establishment of no smoking area with the aim of protecting public health from the direct or indirect adverse effect of smoking. For example, Mataram City has implemented a no-smoking area policy that prohibits smoking in public places as market, entertainment venue, hotel, city park, recreational area, and public transportation. Regional Regulation or Perda No. 7 of 2029 and Perda No. 1 of 2022 also regulate the prohibition of smoking in place or area designated as no smoking area. In addition, the leader or person in charge of public places and workplaces that have been designated as no smoking area must provide a special place for smoking. This policy also includes a ban of cigarette advertising, promotion, and sponsorship, as well as control of tobacco product advertising in broadcast media. This is in line with effort to protect children from the effect of tobacco, including cigarettes, which are implemented in integration and comprehensive manner. Thus, the development of local law policies that prohibit smoking in public places aim to protect the public, especially children, from the adverse effect of cigarette and tobacco products and reduce exposure to cigarette smoke in public places. Assurance of local research to help smokers quit in multiple languages. The government of Indonesia has targeted the development of local law policies to ban smoking in public places, including multiple languages. This is an effort to reduce the adverse impact of tobacco on public health. The following are some key points related to this approach. 1. Tobacco control. Advising a smoker to quit smoking when ill and assisting smokers who wish to quit with several techniques, namely 2. No smoking area policy. Regional regulation of Perda No. 1 year 2022 regulates the prohibition of smoking in place or area designated as no smoking area. 3. Local research guarantee. The government of Indonesia follows the importance of local research to guarantee in addressing tobacco issues. This can be seen in policies that provide financial research to provide nutrition, food for family, education, and more. 4. Opportunity to quit smoking. Quitting smoking will provide greater opportunity to allocate financial research to provide nutritious food for family, education, etc. 5. DMA approach, helping smokers to quit smoking in the form of giving advice or counseling with that 5A approach, namely asking, assist, advise, assist, and learn. By taking this approach, the Indonesian government aims to reduce the adverse effect of tobacco on public and smoker in quitting. This demonstrates the Indonesian government commitment to protecting public health and a healthier and more consuming environment.